All right, welcome everyone to the African Politics Conference Group online colloquium. I really appreciate you joining us today. I think it's going to be a great discussion. We're going to be discussing Sara Fischer's paper, Parallel Paths, How the Global Health Industry Undermines Local Health Systems. Sara's a PhD candidate in government at Georgetown University. And this particular paper is co-authored with Michael Chasukwa, who's also here. He's a senior lecturer at the University of Malawi Chancellor College. And we have two discussants for today's session, Ruth Carlitz, who's an assistant professor of political science at Tulane University, and Dionne, an associate professor of political science at the University of California, Riverside. If this is the first session that you've joined, again, welcome. As an overview for the format, I'm going to be moderating. We'll start with giving Sara a chance to talk a little bit about the paper, about 5 minutes, and then each of the discussants will give up to 10 minutes of comments on the paper. And at that point, Sara and Michael can respond, or we can open it up to questions from the audience. The session is being recorded, so I'd ask if you could please mute your microphone unless you're actively speaking. And when it does become time for questions from the audience, to please use the hand raise function so that I can keep track of people that'd like to ask a question. So without further ado, I will hand it over to Sara. And again, thank you for joining us.
Hi, everyone. I'm Sara Fischer, and you'll see somewhere on your screen, I don't know where he is for you, towards the top, I guess, my fabulous co-author, Michael Chasukwa, who's currently in Malawi. So this paper began actually already a couple of years ago from some pre-dissertation kind of poking around that I was doing in Malawi. I was doing a lot of interviews when I first went in 2018 with kind of donors and NGOs and some Ministry of Health staff. And what I noticed was that there was a bit of a sort of disconnect between the rhetoric of health system strengthening and then what was actually being presented as kind of health programs on the ground, where there were a lot of what I am calling now in this paper, I guess, parallel paths. So the idea that, for example, that you would hire, staff outside of the health system to kind of do the project that you've put forth, rather than, bolstering the health system and the workforce that's already in the country, or hiring new workforce within the government system, right, rather than externally. And so as I went back then 2019 to 2020 and spent a little more time on the ground and started to see some of these changes and shifts and where this is sort of most prominent, and so kind of fixed up the paper accordingly. And then Professor Chasukwa and I had a really great chat in his office about a lot of these same things. And I thought it would be a great contribution to have him on this paper. And so what you're seeing now is sort of my first draft. We haven't really started the co-author process of revisions yet. So there are a few places where I think it has some weaknesses already. And I know Michael and I have already talked a bit about some places where we could add some extra things, but I also I'm really excited to hear everyone else's feedback, for whoever had the chance to read it. And before I stop, I just want to give a couple of minutes. Michael, do you have anything that you'd like to add for people as they're listening or providing feedback?
Yeah. Thank you, Sara, for those introductory remarks. I think you presented ably that in this paper we are trying to understand some issues on development aid in the health industry. So, in the context of a development cooperation, what have been the dynamics, especially from the political point of view, the dynamics between the government and the NGOs, who mostly they're supposed to be complementing the efforts of government. So we're only trying to understand if if such collaboration has been effective, or probably we have ended up with something else that was never intended in the first place. So it's all about politics and development cooperation and development aid that we are trying to understand in this paper. Thank you, Sara.
Thank you. I will stop talking because I think it's more important to hear what everyone else has to say, and pass it off to Kim and Ruth. Thank you so much for taking the time to read this paper and agreeing to be discussants for me.
Ruth, would you like to start?
Yes, sure. Thanks. So I am really happy to have had the opportunity to read this paper, and I think it's timely and important and sheds light on an issue that's relevant far beyond the particular case of, the health sector in Malawi. And so my comments are mainly geared towards revising the paper to submit to an academic journal, which I'm assuming is your goal. And yeah, I think this is something that it'd be great to get, an academic sort of footprint with this. And then I could imagine also writing blogs or sort of more accessible pieces to reach more of a practitioner community. But I think having the academic publication gives it that weight. And so I'm not sure where you're thinking about pitching it, but two journals that came to mind were Studies in Comparative International Development or Development Policy Review, but Kim and others may have other ideas. And I'll send you my comments, sort of more detailed comments, so that I don't take up too much time. So my main comment is that I think there needs to be a more clear argument in the paper. And then you're presenting evidence to support that argument. And so I think one thing that might help would be to play up the empirical puzzle. Although at the same time, I think you need to be sort of walk a bit of a fine line here to not set up a straw man. But I think to me, the most compelling puzzle or sort of contradiction is that the very donors who set up these parallel structures are supposedly engaged in health system strengthening. And I think sort of like the paradox of this sort of health system strengthening, like even putting that in the title, really, really sort of having that be a red thread that comes throughout. So I think really being clear sort of what the paradox that you're engaging with. That being said, I don't think sort of donors setting up parallel structures is a new insight. It happens all the time, unfortunately, even if they say they're not doing it, but you do contribute extremely rich and compelling evidence. So I think kind of framing the paper a bit modestly on the one hand, but also really selling kind of what you were demonstrating in this. And then I think something that is missing from the paper that would really, really help and sort of move it forward to advance the literature that already exists is having some concrete policy implications and recommendations. So currently the conclusion is a bit thin and written in sort of general terms, like this risks confusing communities and, suggesting that donors and NGOs need to think carefully. But, I think it would be a lot more compelling to really grapple with the underlying incentives that reproduce this phenomenon and potentially identify levers for getting out of this bad equilibrium. Otherwise, I think you risk sort of just concluding like, we'll do better, guys. And I don't think that's very satisfying. So I think actually, what are the incentives that sort of, there's the one set of incentives and the legacy of the Paris Agreement and all of these things that kind of promote health system strengthening. Okay, this is a clear, important thing to make aid more effective. And there are, a lot of people who want to make aid more effective. But on the other hand, and this is not unique to health system strengthening, the incentives facing donors in country offices is to push money out the door. And that can really sort of have, I think that's a bigger issue, and unpacking the incentives that lead to both of those forces. And then maybe what are ways of, I don't think you're gonna solve this problem, but but grappling with that a bit more than just sort of like, hey, this is a contradiction and like it's a bad thing, and be better. So I think that would be kind of my big recommendation. And then I mainly had just more comments about framing and style. And I think the depth and richness of your fieldwork and demonstration of local knowledge is really impressive. I think it could be packaged more effectively. Currently, the vignette that begins the paper is very long and a bit in the weeds. Like for me, as someone who, lived in Tanzania for 3 years all told, and has done a lot of work with donors on the ground, like I got it, and I was kind of like, I wonder if this donor is USAID. But like I think that might alienate a lot of readers, and so I think you could still start with a vignette, but what I would suggest is basically reading papers that make similar arguments or address similar issues in the outlets that you might try to publish in, and basically trying to model your paper on those. And then for like a blog or more popular piece, which I really think would be great to write, then you can sort of go into the more personal story. And then just another sort of framing thing is scope conditions. So like I said, I think this is relevant far beyond the health system strengthening in Malawi, but it could be helpful to really clearly map out what is this a case of, and what are the other sort of cases, regions, sectors that can learn from your study, and sort of mapping that out clearly. And then that also sort of sets you up as like, what additional literature maybe do you need to bring in to show sort of what is the state of the art on this topic, and then how do you push it forward. And then I'll end on a very selfish note, which is that I'm currently working on a paper with Sebastian Ziaha, who's at DIE, the German Development Institute, and we're looking at how the impact of aid fragmentation varies by sector, and sort of making an argument that in more politicized sectors, it's really bad, but in less politicized sectors, it can sometimes be useful to have more donors working together, and looking at different levels of government across and within countries. And I would like, there were so many things where I was like, I wish I could cite this. So if there's a version that would be citable, we're trying to get that out. God, at the end of this month, we'll see. But I would love to be able to cite this, and then maybe just offline share that with you and get your feedback, and sort of, I think it's really neat to see work that delves into this at such a level of depth. So yeah, I'll stop there. But thanks again for the opportunity to you, Sarah and Michael.
Thanks, Ruth. I will hand it over to Kim.
Great. Thanks. Ruth's a tough act to follow. She has a lot of great advice for you. So Sarah and Michael, let me just say that I obviously have a lot to like in this paper, because it studies some of the same things that I've been observing and writing a little bit about in the last few years. And so I think it's really important work, and I'm really grateful for the opportunity to have read it. The comments I'm going to share with you are not entirely sincere, in that these are not comments I would bring to your paper, because I know the answers to the questions I'm going to raise. But the comments I'm going to bring to you are the things that people would say to me time and again when I was doing my research. I don't necessarily think that they're helpful, but I do want you to know the landmines ahead of you. Okay, so having said that, right, for the people in the audience, I don't believe these things I'm about to say. Okay, what's the counterfactual? Bros love this question. They're like, oh, but in the absence of donors, things would be worse, right? More babies would die, Kim, like, don't you? Yeah, okay. So you have to be ready to understand, what can you say about, if USAID pulled all of its money out of the health sector in Malawi, it would not create these parallel structures, particularly in districts like Balaka, Mangochi, right, where maternal mortality is high, infant mortality is high. Would the outcomes be better? Would the health system be strengthened? And I think in order for you all to kind of make that argument, you're going to have to mine your interview data in a way where you're thinking about places that have greater donor interference, or places, health workers working in places where donor influence is greater, or matches less to the NCHS, right? Or NHCS, sorry. So, right, the argument, as I understand it, that you're making is that when donors come in, they're creating different structures, right, outside of what is supposed to be mandated by the Malawi government, right? Or let's say the Malawi Ministry of Health. And these other structures, not having the same hierarchies that they're supposed to have, not going through the chain of command in the Ministry of Health, not hiring or supporting the civil servants who are working within the ministry, but instead creating like this parallel health workforce, right? Doing that undermines the existing health system, right? So if that were to be true, then we might look, for example, at different kinds of donors, right? Or at different places where donors have different levels of penetration, right? I think, for example, in this specific case, right, like Goal Malawi might work differently than USAID would, in that, trying not to create the parallel structure. So in these places, and Malawi is one of these places, like many other places on the continent, where donors carve it up, right? We've got Chikwawa and Sanje, you guys get Chitipa and Karonga, right? And when there's lots of problems with that from just a moral standpoint, but from a researcher standpoint, it gives us an opportunity to compare in these different areas, how donors' different approaches might lead to varying levels of undermining the health system, right? I think that similar to Ruth's suggestion about the conclusion and the policy implications, the way I would try to think about this problem, the counterfactual problem, is to really think far down the line. Don't just think about in this medium term, we're going to have an undermined health system, right? Think in the long term, what does this mean for democracy? That foreign funders are influencing the way public services are provided in this country. What does that mean, right? The same foreign funders who have these various programs about democracy and governance are the ones who are creating their own systems for which they are not held accountable at all. And in the case of Malawi, and I think in other places, what this means is ordinary Malawians may not hold their governments as accountable for particular sectors that they see as having significant foreign funder influence, right? So the example I know best, right, HIV/AIDS, a lot of people see that as, a lot of Malawians see that as that's something that donors care about. That's something that donors fund, right? When it should also, be something that the Malawian government cares about and funds. And so we see that now with HIV, right? After 20 odd years of undue donor influence in that sector. And HIV is a part of health, right? So what does that mean for the greater health sector? Are we starting to see Malawians' perceptions of the health sector as something that the government is not really responsible for? So, so to Ruth's point about how you think about in the conclusion, policy implications, I also want to push you to think about the normative implications of this, of what this means. And I think, again, this is consistent with what Ruth is saying of like, if you think about like the implications of your work, it's not just for the health sector in Malawi, right? It's for any place where foreign funders are exerting so much influence that they're creating their own structures. And again, like to Ruth's point, this is not new. But I think it's quite acute in Malawi. As you write, so much of the government's budget is reliant on foreign funds, right? And so, if we think about, and I think you can write, for example, about the current global pandemic and how, Malawian perceptions of who was responsible for providing the resources to fight that pandemic. Were they looking specifically to their government, or were there calls outside? And how does that tell us about who's responsible for health? And I think that, you have a lot of rich data here in the interviews that you've done with people working in the health sector or the aid industry in Malawi. I also think there, for better or worse, Malawi is an over-researched place. And there's a lot of data that has been collected in the country, in particular about citizens' opinions about, various interventions to improve the human condition. And I think that, there's sufficient data for you to even start looking at, how these, the undermining of the health system is not just something that health workers are knowledgeable about. Like, we can show you evidence that it's already undermining the way people hold their government accountable. Okay, so that's my big comment, is like thinking about the normative implications of this and imagining the counterfactual, because that's what the bros are going to ask you. In terms of other literatures you might bring in, like when I was reading your paper, I was thinking a lot of Nicholas Eubank's paper on Somaliland and how, the absence of foreign aid actually leads to state building. So I agree with Ruth. I think you can kind of go beyond health and think about, other literatures. I also think that even within health, I saw a lot of parallels to work that I've read by Adia Benton, who's an anthropologist, and Karen Greppen, who's a health economist, who've done a lot of work on aid, health system strengthening, what it means when foreign funders put money in this way. I think that given your comparative strengths, I would probably pitch this towards a more health-oriented journal. So one with like a really high impact factor, like a health policy and planning or social science and medicine kind of outlet. Though I do agree with Ruth that, this is something you could write about for SCID or something like it. But I think given journals like social science and medicine and health policy and planning, they're academically rigorous, but they also have a lot of practitioners reading it. And I think it's really important that the people who are doing the harm are the ones who are reading the paper. Okay, last thing I'll say. Do you call it Policy Link, this non-named NGO? Project Link. I think that, I think the vignette, I think it could be more clear to a non-specialist. For anyone in the room who's writing something that uses qualitative data, participant observation, what I recommend for the reader's benefit is to fully anonymize but name people. So instead of like interviews being, I-6011, like call them, Jonas Chifumbi. Like, I don't know, just make up a name, right? So that we see Jonas's story throughout. With Project Link, like I would have, like, I want like a name and a plate. Like I want to be able to imagine the story. And even if you're coming up with a fake hospital name, you know, because again, you're trying to protect the confidentiality of your research participants, write it like it's a narrative story, and give these people and places names, and it's fine if they're pseudonyms. But I think it's a lot easier for us to follow the story and the vignette if you write it in that way. But I agree with Ruth. It actually reads a little too. You have to be pretty familiar with the context to appreciate the story, and so share it with people who don't know anything about health, don't know anything about Malawi, and ask them what they learn from reading it, and then that will help you to revise it. I think we're probably a little too insider to give you very good hints on how to do that. I'll stop there and turn it back to our fearless moderator.
Thanks, Kim. All right, Sarah and Michael, at this point, if there are things you would like to respond to or ask clarifying questions about or set us up for other questions, I'd like to give you an opportunity to do that now if you'd like to. And in the meantime, ask members of the audience, if you have questions, please use the raise hand function in Zoom to indicate an interest in asking a question, and then we'll come to those after.
Yeah, I'll start and then I'll pass it off to Michael to see if he has any additions. But thank you both so much for these comments. They're really helpful. Obviously, I expected nothing less. But yeah, I think I'll start backwards. I guess it seems easiest in my brain. But this vignette. I've been struggling with it, as you can probably tell. This is not the first version of the vignette, and I've had even previous versions were like, this isn't clear, same issue, and so I gave it a name. I gave the project a name. So I think I'm like moving maybe in the right direction, but I should probably push a little further. Maybe we'll talk about if we keep the vignette or if we kind of move it into the empirical kind of data section, as Ruth sort of suggested. Yeah, I think it's sort of, I'm trying to find a way to kind of link the story of this parallel paths to something that I saw concretely that just like made me so angry and frustrated, that like you literally are sitting in front of me and acknowledging that you're doing this and that you won't stop, because no one is, as you say, Kim, being held accountable for actually stopping. And so that was what sort of drove that story. But you know, maybe I rethink it a little bit, you know, how it's used or at least how it's written. But I think, yeah, some of these, it's interesting because you talk about this idea of the counterfactual is an interesting one, because I think a lot of times the counterfactual is, what if there were no donors? What if there was no aid? And for me, the counterfactual is like, what if you gave aid better? You know, kind of as Ruth was saying. Like, you know, I don't think there are only two options. There are a spectrum of options, right? You know, anyone who knows me well knows I'm a pretty hardcore aid pessimist. But I don't think that, you know, like dropping USAID altogether at this moment in time immediately is going to be necessarily helpful. And so I think, yeah, thinking through that a little more is probably worthwhile, especially as political scientists, right? People want the kind of alternative hypotheses and these sorts of other these other ideas that, as someone who's trained primarily in kind of, you know, public health, we don't think as hardcore, I think, about some of those questions as political scientists do. So yeah, I mean, I think I was gearing this up more towards like a health policy or development policy kind of journal, like a development policy review or a development in practice or something like that. but I think it still has a lot of work, and I think it's sort of like we'll see where it ends up when we're satisfied with the final thing, and then we'll maybe kind of decide which journal from there. But certainly, I think for anyone who's going to read this that's not a public health practitioner, they're going to ask some of these questions. So yeah, I think that's good. And of course, the scope conditions, those are important, and something that I also haven't really addressed. I mean, I make a sort of hand wavy comment, I think, somewhere in there about relevance to aid bypass environments kind of more broadly. But I think we can work on making some of those clearer, as well as policy implications. It's one of those. Yeah, I probably didn't spend a lot of time on the conclusion, to be fair, yet. So thinking through, what people in Malawi, what the Malawian, and I see we have our friend Gerald Montalvo here, what they would like. He works at the Ministry of Health, for anyone who doesn't know him, but what they would think might be, and I have some of that the data. So I think probably going back to the interviews with my participants is probably the best place to start in terms of thinking through what people, not what I would like to see, but what Malawians would like to see, both the policymakers and the kind of frontline workers. So yeah, and I think Ruth, I think you make a good point about the argument, and I think this is something I've shared this in a group with a couple of people from Georgetown. A similar but not quite exactly the same version, and they had a lot of comments about this idea of intentionality, and whether I talk about how these are like unintended often, and how sometimes they're intended and sometimes they're unintended, and I wonder if I was actually sort of surprised because everyone seemed to have that comment, and here it didn't come out strongly. So I'm not sure if that's if it's just a different audience kind of situation, or if it was maybe not the most important thing. And then, I mean, Kim, just lastly, before I pass it off to Michael, I mean, either now or offline, I'd love to hear your comments about my HIV specific section, given that that's your expertise, and that's where I saw most of this happening for, I think, obvious reasons, like PEPFAR is PEPFAR. I'm gonna not say anything else than that. But I think that there's something I think interesting to be said about that, and I tried to sort of focus most of my dissertation work actually away from HIV. But I got enough of a glimpse of HIV, because you can't not see it when you're there, to realize that everyone I talked to who was doing a community HIV project was pretty much was sort of doing this, and I think that is something else that given the data that I have and don't have, how you think that plays, or if it's worth kind of separating that out. So Michael, I'd like to pass it to you and see if you had additional comments or questions or whatever you want to say.
Okay, thank you, Sarah, for the responses that you have given. And also, we are grateful to Ruth and Kim for the insights that you have given. I think you really took some time to read the paper. So that is much appreciated. I think there are a number of issues that have been raised. One, I think that Sarah and I will be discussing is that issue of trying to understand different donors and how they happen to be working in Malawi in the health sector. Yeah, I think that one is important, because between the bilateral donors and the multilateral donors, they have different dynamics. So if we don't appreciate the differences between the bilaterals and the multilaterals, I mean, our analysis may not be all that rich. So I think that one will pay attention to. But I think even the example that you gave, these international NGOs, some nowadays you find some international NGOs that will be implementing the activities directly, but I think most of them they do some grant to the local organizations, and I think that also brings different dynamics. I think some of our empirical data is coming from Mangochi. And Mangochi happens to be one of the interesting districts, I think, as far as the understanding of development aid in Malawi is concerned. There is the ICIDA, the implementing agency for the Iceland. I think that's as far as I think that's the only international development agency in Malawi that funds the councils directly. I think they have an agreement with the Ministry of Local Government, Foreign Affairs. So in Malawi, they are only in Mangochi, and they are delivering their aid through the council straight. So I mean, if that's the case, probably that we can compare with the other donors that do bypass the local government structures. Because in the paper, one of major arguments is that you have lots of interventions that are being implemented, but probably not passing through the decentralized structures, in particular the council. So I think it's going to be interesting to understand the incentives regarding ICIDA funding the council directly, not even the central government, but the council directly. What have been the dynamics? We have had a chat with them. They seem to be happy with that arrangement. I think even the council is happy with that arrangement because they have lots of funds. Sometimes ICIDA brings to Mangochi more than what the government itself brings to Mangochi, and they're also working in the FS sector. So yeah, we by that direction argument to compare the operations of different donors. On policy implications, yeah, good. I think that's also one of the issues that would be of interest in our paper. The starting point, I think we have tried to do a little bit of it, but it's something that Sara and I will have to enhance. The commitment of the international donors to these international development policies, like the Paris Declaration on Effectiveness, the Accra Agenda for Development Objectives, and the Busani principles for effective development and cooperation. I mean, these are the development policies that these donors signed to developing countries, also signed to, including Malawi. So you have like the Paris Declaration. All donors in the countries are supposed to go through the country systems, harmonization of the policies. I mean, that is agreed at the international level, but when it comes on the ground, you have a different ballgame. Donors bypassing the government and clearly not adhering to what they have committed themselves to at the international level. Hence, these parallel structures that are being created. So I think the issue that probably we might want to tease out in line with what you pointed out. I think for us, what is going to be interesting is, so local policymakers, are they going to be committed to these international development policies when the international development agencies themselves are not committed to? I mean, that could have policy implications. So at the international level, you promise something; at the local level, something else is happening. I mean, that could be of interest to unpack. So yeah, Sarah pointed out, I've seen Gerard is also here, and Gerard should know better. He's in the midst of head. So one of the good respondents there. From the, I don't know, probably from the theoretical point of view, we are also thinking that we should also try to broaden or try to understand, broaden our understanding of the patronage concept. So in the development age, I mean, developing countries most of the times will be seen as clients, and the donors will be seen as the patrons. But we feel like there are also going to be times when donors could be clients and developing countries could be patrons. And I think this is what has sustained this development aid industry. And now it's more complicated with the coming of the traditional donors. Think of China, Indonesia. They're also becoming big in Malawi. These other they're also becoming big in Malawi. So sometimes the development partners will be held at ransom. That's what we're thinking, and that's what the data is suggesting. Sometimes development partners will be held at ransom by the local bureaucrats, by the government, because they know by the end of the day they still have to implement the activities anyway. So there is going to be lots of politics between the development partners and the local players, to the extent that the power dynamics sometimes will change, putting the development partners in a position of clients, and then local actors being the patrons. So that's one of the implications, probably theoretical implications that we'll try to understand in this paper. Yeah, I think that's what I could add at this point in time. Thank you so much.
Yeah, thank you, Michael and Sarah, for those responses. We have two people waiting to ask question or give comment. So I'm going to ask Sarah Lockwood and then Portia Rolos to maybe both give your comments before we turn it back over to the authors. So we'll start with you, Sarah.
Sure. So I have 4 questions. I'll just kind of try and get them out as quickly as I can. Some of them echo things that have already been said, but I don't come from this context. I don't do a lot of work in Malawi. I don't do a lot of work on health policy. So maybe it's helpful to hear it from someone who doesn't have any background. So the first is just echoing what Ruth was saying about a clearer argument. I think I sort of understood what your argument was. I didn't fully understand what was new about it, why I kind of cared about it relative to the broader literature. And that really ties into this opening vignette, which I know a lot of people have already brought up. But it was quite lengthy. It was at the beginning. And I really didn't, I enjoyed the vignette. I understood what it was kind of, it made sense to me, but I didn't understand why I cared about it. And I think that's because I didn't fully understand how it related to the broader argument. So it actually wasn't until the conclusion when you said, as I said in my opening vignette, and I went, oh, that's why we had the opening vignette. So I think not necessarily getting rid of the vignette. I think it could be shorter. I think it could be tighter. But I really think it could be much more clearly linked to your argument, kind of really walking your reader through why they care about this vignette. So that was the first thing. The second thing is, and this kind of ties into some of the comments that were made about scope conditions, but why Malawi? What is it about Malawi? Not necessarily why did you choose to study in Malawi, because that might have all sorts of reasons, but what does Malawi illuminate about some broader problem? And I think that'll really help with the scope conditions. I think it'll also help you sell the paper more, because I think this is a really rich paper. I think it makes an important argument, but at the moment it's making a very localized argument just to Malawi. And I think kind of broadening that out would just help sell it. And sell it to journals, right? Journals, I think, are going to be much more interested in it if they can see why it's relevant for, all developing countries or all countries with this type of government, rather than kind of just Malawi. Tying a little bit into that, there's been some chat going on, and I think a couple of people have mentioned it, and there might have been a response that answers this, but if you don't have one, I would really encourage some sort of methodological appendix. I wanted to know so much more about your research design. I wanted to know, broadly speaking, who did you interview? I wanted to know how language featured in that. Were you interviewing in English? Were you interviewing in local languages? If you just interviewed in English, how might that have biased the responses you got? Which areas are these NGOs working in? How do those areas compare to other areas in Malawi? Which NGOs, and I don't mean specifically, I know you're being really careful to kind of not name people, but are they big NGOs, little NGOs? Are they working, nationally across the country or in just one region? Are they working across broad healthcare issues or narrow healthcare issues? I think that would just really help me to understand kind of what's going on. The third thing is I really wanted to understand the problems more. And kind of, I understood in a theoretical way why these parallel systems were a problem, but I didn't understand in a really concrete way, right? What does that actually do on the ground? Who are the people being affected by this and how are they being affected? And you do sort of talk about it, but I really wanted some kind of concretization there. And then finally, and this is a tiny thing, but it just threw me, so I was going to bring it up. This is a co-authored paper, but all the way through it, I do this, I argue this. It just slightly threw me. It kind of made me wonder, is this one person's work that somebody else is kind of coming on to? Like, what's the balance of work and argument between the two co-authors here?
Thanks, Sarah. Before we turn it over to other Sarah and Michael, Portia, would you like to ask your question?
Hi, yeah, I'm Portia Roloffs. Thanks so much for sharing the paper, and also to the organizers. This is the first time I've been to the African Politics Conference Group online colloquium, so I'm really excited to participate. I wrote a whole ton of questions, and I may be writing them from a similar perspective as Sarah, who just spoke, and that I'm familiar with development debates and I work on Nigeria, but I don't really know anything about health or Malawi. So I do have a version of the document where I've just kind of been like the reader questions, being like, who's this? Oh, am I meant to know who this is? And so I can send that over. But kind of three kind of potential questions or possibilities for sharpening the argument. I got a sense throughout that there was, I felt like I was reading something that was like really sensitive, and you had to anonymize so far that we really got very little context about any of the people who the quotes were from or the case studies were about. And that kind of created this gulf between your methods, which were ethnographic and fine-grained, and the knowledge that the two of you have combined, and actually what the reader then gets. And so I wonder if the kind of choices that were made about like anonymization, like Professor Dionne raised at the beginning, could be skewed slightly differently, and there are other ways of resolving that tension. And the kind of genericness, I thought there are possibilities for how you could disaggregate on a whole number of the different themes. So like disaggregating between different types of health intervention or different types of NGO, different formations of parallel paths as well. So what does a parallel path look like at the level of high-level policies and statements of vision and what we're trying to achieve? What does it look like at the level of infrastructure, and what does it look like at the level of kind of the user experience? So all of this will depend on like what's interesting in your ethnography, but these are possible points that as a reader I was kind of thinking could be really interesting. Secondly, I also felt like I needed a clearer explanation of the stakes of the paradox that you presented, or the contradiction, because working on aid, I was like, what? Like, so a donor said X and it did Y, I'm not finding that like a kind of motivating, I'm not feeling indignant. I'm like, well, that's just how they operate. And so I'm guessing there's something deeper there. Like maybe this is a really massive part of Malawian context for donors. Maybe they've committed to it at such a deep level. Maybe it's the main thing they talk about, in which case this kind of contradiction in terms of what they say and what they do would be maybe more interesting. Or is it a big political issue? Are there lots of Malawian grassroots groups organizing against this, in which case it might also, the stakes of this contradiction might be raised. And just in terms of the kind of, what does a counterfactual look like? I wondered if Rwanda might be a good comparison of, well, if you look at a country where the government really says to donors, like, you play by our rules or you get out, this is how it's worked. And then obviously Malawi's, most of its budget comes from donors. That's going to be a different sort of politics. And then finally, just as you were talking, I wondered if there was a possible framing that you draw on commitments to increasing local ownership of aid from about like 15 years ago. So you could say like 15 years on, what's the state of the parallel path state strengthening kind of predicament? And something, as Michael was talking, I wondered if when maybe the form that parallel paths take has changed over time as donors have become more aware of the fact they have to kind of cover up what they're doing. And so are they using words like grassroots, civil society, volunteers, community groups to say, oh yeah, the government can have its own ownership over state policy, but what we're doing is totally different. So it doesn't need to align. And that would be really interesting to think about how they've kind of progressed over time. But yeah, really interesting paper. And I think it deserves to come out in a kind of development studies journal.
Thanks, Portia. So we have about 7 minutes left, and despite it being a little bit unsatisfying to not hear from the authors, I'm going to suggest we take questions from the 2 other people in line, just in the interest of getting as much feedback as possible. So Mugabe Ivan, do you want to ask your question, please?
Thank you very much. Well, my question basically relates to the methodological structure. In the methodological framework, I think the paper specifically looks at the data and specifies that this data was collected from 2 particular districts in Malawi. To be very specific and particular, we are looking at where the paper is specifying the districts of Lilongwe and Mongachi. Now, I'm just very again interested to come back to the question of why these districts. I mean, Malawi is a big country with a number of districts. Now we need to know what's the justification for narrowing or zeroing down to these particular districts at the end of the day. I think adding that in the methodological framework, that will kind of clarify the reason for the choice of those districts. Well, it's very clear the method of sampling, which was used in terms of choosing the participants, which is snowball sampling, but we don't know whether also the districts, the choice was sampled. I think that will be key and very important. And then again, another comment I will try to make here is in relation to the IRB, Institutional Review Board clearance, which is mentioned in the paper, again, in the methodological approach. And it looks, the paper seems to come up with an element of a collaborative arrangement between Malawi and a US-based university, right? And that's why there seems to be a double sort of clearance from the Institutional Review Board in Georgetown University, and as well as the National Commission of Science for Technology in Malawi. I think what we need to understand is probably where the standards and expectations of these 2 bodies the same, and having 2 different clearance expectations really make a big difference. I think that should come out because Malawi's institutional, what probably we can call ethical review commission for purposes of empirical research may have very different. I think that comment needs to be very clear because we are able to see that, well, there was a double clearance which was attained, but we're not able to understand why that was done. So I think that must be the why question remains hanging. So we need to know the rationale why it was important, not to just have clearance with the IRB in Georgetown, but also have another clearance with the National Commission for Science and Technology in Malawi. I think that needs to be further strengthened and clarified. Thank you.
Thank you so much. Dr. Jokunemo?
Okay, thank you. Nice paper. I actually read through and it was actually interesting. But I want to emphasize on something. The paper is on Malawi. When I read through, what is actually going on is not different from what goes on in other African countries. I think somebody mentioned that. But I'm just wondering, the donors and NGOs are doing a lot. But if they're doing a lot, why is there this disconnect between the government, the people, and the donor? By the time they finish whatever program they have and they go, there's no continuity from what you said in your paper. So the question is, what is causing that? Is it that the government is not ready to effective or good health system for the people? Or is it corruption? Or is it policies that are not being well implemented? Or is it that we don't have Malawi don't have good policies that can actually bring these things to play? So there's need to bring that out. And then you need to emphasize, make a lot of recommendations. How The donors can work for a few years and still continue. The impact of their work will continue to be felt for long rather than just leave it hanging. It's like a lot of information is coming out, but very little solution to it. I think that's okay.
Thanks so much. And I think we have time for just one more question from Carolyn Holmes.
Hi. So I read this paper with a tremendous amount of interest, not as a person who does public health or even studies Malawi, but I think it's just really interesting because, and I got stuck on this idea of parallel structures, right? And I'm wondering who thinks of them as parallel, right? Are they in fact parallel or are they contradictory? And this is sort of building on what Portia said about the idea that maybe donors don't see these structures as being like inhabiting the same space. You know, if they are non-political, right? If they are just civil society and community groups, what does that do in terms of leverage, right? Are they parallel? Are they contradictory? And what is the space in which all of these actors think they're operating versus sort of what their mandates are in practice and sort of on the ground? So what is it about these parallel structures that sometimes are parallel and sometimes they're not, right? Sometimes they're overlapping. So I'm wondering about the sort of implicated definitions of politics and, as Kim said, democracy in terms of the implications of these arguments.
Thanks a lot, Carolyn. So a lot of great questions. I don't think you'll have a chance to answer them in 2 minutes. And I also want to encourage anybody that has lingering questions or suggestions for the authors to please follow up via email. But Sarah and Michael, do you want to say anything just to wrap the session up in about a minute?
Just very quickly, yeah, thank you to everyone who has pointed out so many areas where we can improve this paper. I'm looking very much forward to collaborating with Michael on moving this forward, and I'm sure that whatever comes out is going to be a very different version from what you've seen here today. You know, Mike, I have great faith in our work together with Michael, and I'm not even going to try to honestly to respond, but just to say thank you for all of these comments, that they were very helpful, and I appreciate them all. I think we'll take them all into very strong consideration. Michael, do you have last words?
I think you covered almost everything. Just being grateful for the feedback. I think you have had very good comments. I've also gone into the chat room. I think the conversation is also great there. So we'll be assured, I think we'll put into consideration, I think, all the feedback that we've received. Yeah, so thank you.
All right, thanks so much. Thank you for everybody for joining and contributing. I think this was a great conversation about a great paper, and I look forward to seeing revisions of it in the future. And we'll have 3 more sessions of the online colloquium. We'll be sending out emails about those for the remainder of the semester. So I hope you'll join us then too. Thanks so much to Sarah and Michael for sharing the paper.
Thank you all so much.